7th and Yarnell Streets in Chester. Vaccines are available for everyone ages 5 and up. Bring your wife, bring your kids, bring everybody. Let's get vaccinated. And we're doing a live broadcast there, which will be hosted by Chester's very own funny man, Lamar Todd. We're having a discussion with the moms tomorrow right here at cmpradio.net at 7. So tell the ladies to join us tomorrow. But tonight we are in the man cave. So I'll introduce the fellas and step out of the room so y'all can talk. First, we have Brandon Brown. He specializes in infusing trauma-sensitive conversation into medical teaching, public school transformation, community engagement, and vaccination hesitation. Dr. Neil Pitts is the director of COVID-19 vaccination project at Temple University's Lewis Katz School of Medicine. His team provides COVID vaccinations to underserved neighborhoods in Philadelphia. He also leads the teams that provides education to those same neighborhoods on vaccine hesitation. And to represent the concerned fathers, we have Uncle P. He is the founder and CEO of cmpradio.net and is an intervention specialist for the Chester Peace Initiative and the Chester Community Coalition. He is multitasking this evening, so he'll be on and off camera, but he's here with us. Before I go, I want to let you know that Dr. Justin Foster is here, and he'll be behind the scenes with me to help find answers to questions that the panelists may not be able to answer. We want to make sure that every single question you have is answered, and sometimes very technical questions come up, like how many Black people died of COVID today. If we have to go on a search and find that information, we'll do that behind the scenes in case the panelists can't answer. Dr. Foster is a fellow pharmacist, so you are in good hands. Brandon, it's all on you, bro.
Dr. Motley, I want to thank you for the opportunity to be sitting with such an august and interactive body this evening. We're just really going to have a conversation. This is more of a conversation, not a confrontation, right? This isn't about conversion. This is just about understanding. So we're not trying to have like a replay of Radford, or we're not trying to have a replay of Springford. They had some, I don't know if you know Uncle P and C's, they had some really contentious arguments in those spaces yesterday just about masks, just about the need to wear the mask. So we understand that this COVID conversation is real. It's forced us into a new reality. But even in that new reality, there are still some basic understandings. So with that, I'm just going to say good evening. My name is Brandon Brown. I serve this event tonight as the facilitator. I work with the Lewis Katz School of Medicine Center for Urban Bioethics, Philadelphia Healthy and Safe Schools Initiative, via the Center for Urban Bioethics. I will be the facilitator for this evening. If I could, I just want to set the ground rules. I believe that in this space, multiple versions of the truth can exist, right? So it's not necessarily that one person is right and the other person is wrong. Hopefully in this space, we can recognize that it's all just about hearing the individual, because I believe that there's a difference between understanding and acceptance. You might not necessarily have to accept someone's position, but as long as you can understand it, that might put you in a better space, right? So, with that, having said that, I'm going to ask Uncle P and C's and Dr. Pitts just to give us a little flavor for yourself. Can you introduce yourself for everybody that's assembled watching us this evening?
How you doing? I'm Jean-Pierre Bryce, better known as Uncle P. I'm the CEO of cmpradio.net, and I'm a father of 7 children, and I'm concerned, right? And I want to know. I am not I guess I have not been vaccinated, right, or vaccinated, right. I'm not a pusher for the vaccination. I just I want to watch things happen. I love science when I was younger. I always thought myself to be a doctor. So I'm like, let me study this a little bit. Let me look inside of how this really works and understand it before I put it inside of myself. I have a daughter who goes to Lincoln University, LU, and she's been vaccinated, right? My other daughter, right underneath of her, she's a senior in STEM. She works at Riddle. She's been vaccinated. Their mother, who has lupus, she's been vaccinated, right? My son doesn't really want to fool with it. He's rocking out with me. He's like, let's see what's really going on and how this is handling itself. So I'm here to learn and understand, right, why I should be vaccinated.
Thank you so much. C's.
Good evening. My name is Cliff. I go by C's. I am currently on my first dose of the vaccination. It was mandatory for my job. I wasn't a big fan of that, which is kind of why it's taking me so long to get my second dose. And I'm a single father of 3 sons. My lady, who also has a son who I am with, and she is currently pregnant with twin boys. So soon to be a father of 6 boys. And I'm a community activist. My job is an intervention specialist with CPI, so I deal with the community, and I'm also always in people's spaces. Like, I don't want to say their face, but I'm always in different spaces with different people. So I'm here to learn about the vaccination as well for my kids more so than myself, because I'm old enough to make a decision and deal with the repercussions. But my kids, it's like they don't have a decision. I have to make that decision for them. So I want the best information before I decide to vaccinate or not vaccinate my children.
Thank you so much. Dr. Pitts, tell us about yourself.
Good evening, everyone. Glad to be among all of you. My name is Dr. Neil Pitts. I also a colleague and a close friend of Mr. Brown. In addition to that, I am the director of the vaccination project, COVID vaccination project at Temple University Lewis Katz School of Medicine. As was said in the introduction, I do a lot of education as far as the COVID vaccination is concerned. And I'll tell you, it's more than education. Mr. Brown alluded to it earlier, is that we just want to have a conversation. And I do what I call community conversations, and I just ask people to enter the conversation. I've had a lot of people say, I don't even want to talk about it, right? And even those people, I still urge to enter the conversation. That's what we want to do tonight. So I am very glad to be with all of you.
So thank you. So I have set questions, but Uncle P, I'm pretty sure sometimes you just got to go with the flow of it, right? So I think first and foremost, let's just deal with some of the elephants in the room, right? So Uncle P, what's your position about getting vaccinated?
I can't say I'm against it. Again, I feel like all vaccinations, they take time, right? So I wasn't on the first bus to say, yeah, let me go ahead and put this in my body, right? There was a lot of I guess untruths and rumors going around about the vaccination. So I decided to do it myself, herbally, right? Sea moss, elderberry, whatever I could look up and find that boosts my antioxidants and things inside of me. I went with it, right? And So I can't say I'm against the vaccination. I just want to make sure that it's good for me and healthy for me. I have high blood pressure. I don't need anything affecting my high blood pressure. I don't need anything affecting anything else that I've already messed up or triggering something else to be messed up. So, yeah, I'm waiting. I'm waiting and I'm watching.
Okay. So what I'm hearing is like, because there was so much conversation and probably confusing conversation about it, you were just like, you know what? I'm going to go the homeopathic method, at least for now, until I'm in a space where I'm comfortable with the information. Is that what I'm hearing?
Yes, absolutely.
Thank you so much. C's, I don't know if you caught the question, but sort of like, what is your position about getting vaccinated? I know that you said that you had to get it done.
Not yet.
I know that you said you had to get it done for work, but what is your position about getting vaccinated?
I mean, I'm on the level and the scale where to each his own. I feel as though everybody should do research, and don't just go off the mass opinion, actually do your own research. Personally, I'm not a big fan of any vaccination, you feel me, especially so soon and so quick. So it was kind of difficult for me when they put me in a position to be vaccinated because, one, I like the job that I'm doing and I like the role to be able to help my community. So I felt like it was a sacrifice against my personal beliefs. And, like I said, it's just, I'm not for it. I'm not against it. Everybody makes their own personal decision. My dad's vaccinated. Like I said, I'm in the stages of being vaccinated. So a lot of my friends are vaccinated. So, like I said, to each his own. Me personally, I'm on the fence, when it's kind of hard to be on the fence when I've already put it in my body. So, but like I said, to each his own. I'm not encouraging nobody, I'm not discouraging nobody, but I will be part of a conversation and help inform my community.
Can I lean into this for a second? So let me ask this other question. Is it, you would not be vaccinated had it not been for your job? Is that what I'm hearing?
Absolutely.
Okay. And then can we lean into that? Just why no vaccination? Is it very similar to what Uncle P was talking about? Just like not knowing, just like where's the apprehension? Help me understand where the
when the COVID-19 first hit in late 2019, early 2000s, I was very cautious. I moved very carefully, and let's just pretty much say I haven't experienced COVID. I've traveled on planes. I've continued to say basically living a regular lifestyle, and I was never positively or negatively affected by COVID. Like I took a test, they were negative. I never caught COVID. So I just felt like, I don't want to say COVID was a myth, but I just feel like my immune system in my body is different. Everybody's immune system is different. It handles different diseases and viruses at different variations. So I just felt like my immune system was healthy. I didn't really need no extra boost or no vaccine, I should say. But, different strokes for different folks. My dad, he got it. I took him to go get it. You feel me? Because he's 75. He has health issues and things like that. So I know, you got to do your research, and it's a personal decision at the end of the day.
And C's, just can I ask the question? Do you have any pre-existing health conditions?
No, sir.
Okay. All right. So Dr. Pitts, you heard Uncle P. Uncle P is like, hey, there was too much confusing conversation in the very beginning, right? And then you've heard C's like, I'm hearing about this COVID stuff, and they're talking about it, but I mean, does it really apply to me? Like, do I really have to do it? Like, how do you feel about those responses?
So I understand all of it. I'll be honest with you. We've had a lot of information, as Uncle P was saying earlier, and C's was also saying. We had a lot of information that was false information. We had a lot of information that was discrepant information and differed with something that somebody else said earlier, and it just caused mass confusion. And I get that. I get that. And so, I sort of delved into it with a way of looking at this. When I talk to audiences, there's no judgment. There's absolutely no judgment. There's no criticism, but I will tell you that, some of the facts sort of address some of the things that were just said. For example, Uncle P, you were saying earlier that, it takes time for the vaccination for vaccinations to be developed. And, over time, people have looked at this and said, well, listen, I know that if I am looking at a vaccination and I hear and I know scientifically that vaccinations take, 8, 9, 10 years to develop. And now, I've got COVID, COVID comes along, and a year later, they come up with vaccination. Okay, what's up with that? And I hear that. And so my response to that is that, the active ingredient of the vaccination, there is something, and I'll be a little technical. I gotta be technical because I believe that everyone should have the facts and everyone should really be up to speed on at least understanding the concept. Not not the nitty gritty of everything that's going on, right? I'm a scientist. I can't expect everyone to understand. Uncle P, I'm so glad that science was one of your favorite subjects when you were a kid. But I will tell you that the first paper was published for the mRNA. Remember that term, mRNA, and that's my first technical part of this. That is the active ingredient in these vaccinations, right? Doesn't contain other things. It contains mRNA. The first paper on mRNA was published 50 years ago. 50 years ago. And if you fast forward another 11, 12 years ago, or so after that, it was first used in human beings about just about 39, 40 years ago, right? And so people have been testing the effectiveness and the safety of this thing called mRNA for that period of time. And in fact, it's been used in vaccines before. So it's nothing new. Now, where COVID is concerned, you of course recall that that a couple of other similar pandemics were with us for short periods of time in the past. There's a SARS-1 virus, and there was a MERS, both structurally very similar to COVID-19, to the COVID-19 virus.
So if I can, Dr. Pitts, what I'm hearing you say is that the COVID vaccine is like 50 years old. Like it's not a fledgling, but it's almost a senior citizen.
It's almost a senior citizen, I won't go so far as to say the vaccine. I will say the ingredient for the vaccine.
The main ingredient.
The main ingredient is 50 years old, and so having been studied over that period of time, scientists are familiar with its effectiveness and its long-term safety. And when you match it with those other viruses that were with us, so that scientists could match it and use it against those. When COVID-19 made its presence known, the scientific community was absolutely ready. They were absolutely ready.
So, Dr. Pitts, I'm going to ask for a favor. Are your headphones plugged into your computer?
They are not. They're wireless.
They're wireless.
Yes.
I'm wondering if what you can do is if you can just talk straight into the speaker, because we're getting a little bit of feedback. Are you getting that, Unc? Are you getting a little bit of feedback?
All right, let me see.
So
Let
if
me
there's any way that you could disconnect them, that would be great. And then we
Sure,
can just
sure, sure, sure. Gotcha. All right, tell me
Actually,
if I'm
it
doing this
sounded
right.
better when he was talking better into the speaker. But anyway,
All right.
so hey, Uncle P, let me ask you a question. So we sort of laid the foundation as to why people might not be vaccinated, but let's dig a little deeper. Why do you think Black people aren't getting vaccinated? You're on mute. You're about to drop some knowledge, so I want to make sure that I hear it all, man. Because
I think it plays a part on trust, right? Can we trust the people that are making this? Can we trust the government? You know, there's a lot of untrustworthy history relating to us as it comes from the medical field, right? And I've had conversations with all types of people that are in the medical field, from doulas to doctors to nurses, and everybody telling me, "Oh, you got to trust this. It's not like the Tuskegee experiment." And I said, "Oh, I definitely understand that, right? They said they were giving something, they weren't giving anything, right? But here they're really giving something. And if mRNA is 50 years old, why are we just hearing about it, right? Why wasn't this something that they were talking about before COVID hit? Oh, there's a new vaccine out. Then we think about all the children and everyone that have gotten vaccines, and they put autism. Autism is the vaccine is the reason these children have autism. You have a lot of parents that weren't getting getting their child vaccinated before COVID. So for me, when COVID hit, I was like, oh, all right, put on a mask, stay away. I've been washing my hands. I've been spraying down things. So for me, I'm in my bubble already. I'm good. I'm this where I'm home at. So I don't have to get vaccinated. But for me, it's about trust, man. Trusting what you're getting. I have brothers, you know, you could consider him to be brothers and sisters. You consider them to be overweight. They're scared of the vaccination because they're like, man, I could die. I could have a heart attack. Like, I don't know what's going to happen. So, you know, I say you wait and you see, but stay masked up. If I could wear a mask for the rest of my life, I would. Right? Literally, I don't have a problem with that. Right? You know, I was never really trustworthy of shaking people's hands anyway. I'm dapping people and everything else. Right? So, you know, I'm in my zone right now with everything that I'm doing with this vaccination. But the trust of this drug being injected into us, the trust of just anybody is hard when you're coming from the Black community, because we get so much misinformation and whispers into the community and whispers on this side. So then when you see everybody dying, literally when it first happened, I was like, all right, I'm not getting vaccinated. When I see somebody's head explode walking down the street, just randomly explode, I'll be the first one in line to get the vaccination. Until then,
man, this ain't no B scientific movie, man.
I don't know what it is.
This ain't no creature double feature.
They shut the world down because of this. They closed stores. They had you in the house. And then when I heard that it could be given to animals, so I'm like, so it's a lion in the zoo. It was lions that died, snow leopards that died, and were COVID related. I'm like, this ain't going nowhere. When it first happened, I said it's no different than the flu. And I've never gotten a flu shot. So if I've never gotten a flu shot, I ain't getting no COVID shot.
Gotcha. Hey, C's, you want to add anything to this? Like, why do you think people of color aren't getting the vaccination?
Yeah, just to piggyback off of what JP said, it's definitely got a lot to do with trust and not knowing, you know, and us having a history of being, you know, just misled as a people. So it's definitely got a lot to do with trust, not knowing, you feel me? And, you know, when smallpox and diseases like that back in the day came about, it took them years to find a vaccine. Now, granted, you know, science has improved tremendously over the time, but it's just still that what if factor, you know, like, okay, say, I know I hear a lot of Black brothers say that, oh, they're not giving us the same vaccine that they're giving them white folks. You feel they just want to test it out on us and kill us. So it's really just comes down to trust and who and what you know about the situation.
All right.
As far as like just information. So it's definitely a lack of information, you feel me, and not knowing or being secure with the vaccine as a whole.
All right. So Dr. Pitts, Uncle P comes at it and says, you know what? There's history here. There's reasons why I don't want to get pricked. Right? C's is saying, like, look, You know, does any of this make sense? Right? So how would you respond to individuals that say, you know what, I'm having issues or trepidations with this vaccine thing because of the medical system's historical abuse or misuse of black bodies. Can I say it that way? Okay, is that cool, Uncle P? Can I
Yeah, that's
put it
cool.
like that?
That's cool. I'm
Right?
good
Because
with that.
I gotta put Dr. Pitts on the spot. He ain't sweating yet. Right? So we gotta have a little bit of fun with this. Or, or is it just about like the medical system has done nothing for people of color? So why should we even begin to put faith and trust in it? How would you respond to that, Dr. Pitts? I think Dr. Pitts is frozen.
Yeah, I think he is too.
Which is fine, because I'm pretty sure that Dr. Pitts. So let me ask Uncle Pete, let me ask you a question. Have you seen the article? Because a lot of people, when they talk about it, they want to talk about, like you did, Uncle Pete, when you were talking about the Tuskegee experiment, right? And I am curious if either one of you saw the article in the Washington Post. It was like probably in March, where there were descendants of the Tuskegee experiment, and the article simply says, "Stop using our ancestors because we're vaccinated." Are you familiar with that article?
No, I'm not, but I'm gonna look it up as soon as we're done.
If you
I
can't,
haven't heard of that either.
if neither one of you can't find it, I'll make sure that you get it. But I think that it's a really good read, right? Because a lot of people were using the Tuskegee experiment sort of as like their foundation,
Right.
as to why, there's this medical. But I mean, in truth, if we were to look at COVID, and Uncle P, you kind of hit it on the head, that you can't really compare COVID with the Tuskegee experiment because just the conditions were different.
Right.
But there's a person, there's a picture of an African American woman on the front, and the caption is basically like, if I had to decode it, the caption is like, "Stop using my people."
Up if you need to.
They're like, "Stop using my people," because we're vaccinated. Justin put the article in the chat, so thank you, Justin. Dr. Pitts, can you hear us?
I can hear you. Can you hear me
You
without
sound
the echo?
You said, well, it's a little staticky,
Right.
but here's what I think you're doing. If there is some way that you can just talk into the piece a little bit better,
Okay, I'll try that.
Yeah. Can you talk into the
piece? Is this any better? Yeah.
Take it from just a little. Take it away from your mouth, just a little bit.
Okay. Got it.
Say something. Testing 1 2 3.
Testing 1 2 3.
I'm gonna take a little bit closer to your mouth.
Testing 1 2 3.
You know what? I'm gonna live with that.
Right.
I'm gonna live with that in this space, if that's okay.
Sorry about that. Yeah.
So here we go, Dr. Pitts. Dr. Pitts, we asked the question like, "Hey, why aren't African Americans taking the vaccination?" Uncle Pete said this is a thing about history. This is a thing about trust, right? This kind of came in on that same line. That's like, and then my question to you, Dr. Pitts, is that why should African American communities have any type of loyalty towards medical systems that have misused and abused Black bodies for their sport and their benefit? So I had told, before you went blank, I told Uncle P that I hadn't made you sweat yet. So there's your sweat question. There's your sweat question. I'm just going to sit back.
It to me, man.
Just going to see how this is going to work.
Right.
You're testing me, man. We had to do the Brandon and Neil show, right? So we've done this before. So yeah, I hear that, and basically, the whole thing about Tuskegee, right? And that was, 100 years ago. There's the issue of Henrietta Lacks. There are a lot of issues that are going on, right? And people are distrustful. There is the issue even of individuals now who will walk into a doctor's office and feel absolutely disrespected and not treated with dignity or integrity. And I get all of that. The issue is whether or not we are now moving fast forward and trying to evaluate whether or not we have to determine a way to move into medical spaces by finding someone within that medical space that we absolutely do have some faith in, right? And in doing that, we solve a lot of issues. I mean, yes, there is the COVID issue, right? But there's also the issue of healthcare disparities in general. Whether or not I trust my physician to tell me correctly to take my hypertension medication when I need it, because if I don't do that, I might die, right? I need to take my diabetic medication because I might die. So it's not so much, it's about COVID, but it's broader than that. And we as African Americans, I think I would like to see us as African Americans move into that space of confronting these issues, not forgetting them for sure, but confronting them and talking honestly with practitioners about things having to do with healthcare disparities, but also talking about racism and bias, right? How do we begin that conversation? If we do not begin that conversation now, then African Americans will continue to die at higher rates than white people. Already, COVID has decreased the lifespan of African Americans. Well, everyone has decreased their lifespan, right? Of whites, it's almost 1 year. Of African Americans, it's 3 years, 2.9 years. Our life expectancy across this country has decreased. So what I'm saying is we need to find a way to come into those medical spaces and have that conversation honestly, and really forthrightly with our medical counterparts.
So, Dr. Pitts, what I'm
Yes,
hearing
sir.
what I'm hearing you say is you're recognizing that the past is the past and that those things have happened, right?
Right.
But I'm also hearing that one of the ways that a lot of this can be remedied is that if we have sort of trauma-informed, racially literate, culturally competent physicians that are in this space to have holistic and healthy conversations.
That's correct. That's correct. And such individuals, are there now. Yes, go on. I'm sorry.
Uncle Pete sees how you feel about that. He's saying like, all right, I get it. We got Henrietta Lacks, right? We got the Tuskegee experiment, but I just gave you the article, or Justin just gave you the article. How do you feel about that?
Okay, my fault, bro. I don't want to say I don't believe the doc information, but I need to physically see numbers where it says that COVID is shortening the lifespan of Black men. You feel me? Because in my community, I don't see us getting COVID unless us as people getting tested, not telling us. Because the Super Bowl, the All-Star game weekend just passed, both events, not near a mask in sight, and these celebrities was the same one pushing, wear your mask, make sure you get vaccinated. And then here it is, February, you got an event where hundreds of thousands, possibly even millions of people are gathered in one space and nobody has a mask on. The All-Star, the NBA league rules is that players on the bench are supposed to wear masks, but for this 1 week and nobody had to wear a mask. Right. That's fishy to me, bro. When it comes to all these statistics and numbers, I just don't believe it. Like, not saying that you're not speaking facts, Doc, but from what I'm seeing with the naked eye, I'm just not seeing, 1 minute, hey, COVID's real serious. You should go get a booster shot. That was just not even 30 days ago. They was talking about, oh, it's ready to be another wave and it's about to get real crazy again. And then here, Super Bowl weekend, All-Star weekend, nobody got a mask on. These are the same people that was pushing it. So, like I said, it's just it's so back and forth with the information.
Sees, if I could, because I hear and understand everything that you just said. Can I ask you a question before we go over to Uncle Pete?
Absolutely.
Do you think that some of your confusion about COVID was simply because of the way COVID was introduced here in the United States? Because if you look at how COVID was introduced in other countries, it was handled in a very, very particular way. right? It was they
Absolutely.
like when it hit Thailand, when it hit all those other places, like the response was, this is serious and we need to handle this, to which they did. Uncle P was talking about that in the very beginning, how countries were shutting down, right?
Absolutely.
However, when you get to America, right? And I don't want to go down. I don't want to go down this rabbit hole, Uncle P. I can't because we only got 23 minutes.
Right.
I can't go down this rabbit hole because we got to stay on course. Dr. Motley would, I want to stay on course. But do you think, sees that the way that COVID was introduced to us, not us, just Black people, but us in the United States, created so much confusion with regard to how we should really be handling this? You have any position on that?
Yeah, I believe that could have a major part, because, like I said, we've been told one thing, and you see people blatantly ignoring the orders of our government. And I don't want to say, because I don't know what people's situations are, you feel me? But I heard of the death toll numbers just in my city and the COVID cases in my city, and I was never really convinced, And maybe that's, like I said, because we didn't take it as serious, so it never really seemed like it was life threatening. I mean, I've known people close, not real close to me, but I've heard people close passing away of COVID, but most of them had health issues. So then again, like I said, it's an information situation. It's a numbers game to me, per se.
Well,
Got you. And
yeah.
hold on, Dr. Pitts, before you get in, I want to pull in Uncle P because he's been sitting there brimming to say something.
No, I mean, Caesar's absolutely.
I'm using your words. I'm like, everybody shut stuff down, but for here it was like we had the ability of choice.
And I think that's the thing that separates America from every other country, right? Is the ability to choose, right? I mean, it's the land of the free. You know what I mean? Like, can't nobody tell you this? They put us on a 2-week. We was supposed to be what 2-week quarantine, and everything was shut down. But when I heard that the deer still had it, I'm like, well, a bird can have it. Poop on my shoulder, and now I got COVID, and I was in the house for 2 weeks, right? So how is that helping this? Again, when it first came out, for me, I compared it to the flu. It's just a real bad flu, right? And for a real bad flu, and then everybody jumped on me. Oh, you can't compare this to the flu. People are dying. I'm like, don't people die from the flu?
Right.
Like, people die from a lot of different reasons, for a lot of different reasons, but if we're comparing the two and we're trying to understand where COVID came from, it was made in the laboratory. It's a lot stronger than the flu. It wasn't supposed to get out. It was in Wuhan, China, wherever in China that they sat and did this stuff. So it's like, yeah, throughout the course of that, then we had Donald Trump, our president, right, sitting there talking about drink a gallon of bleach, and you ain't got to worry about COVID. It was a joke to himself, because he knew he wasn't going to drink a gallon of bleach. So then it's like if everybody playing with this, if your president is joking and calling it the China disease, you know what I'm saying? And he's playing around with it. How serious is it really? And then they come out with the vaccine. So for me, it was like, yeah, you can get the vaccine if you feel as though COVID scares you that much that it's going to take your life. You can get the vaccine. And just a couple minutes ago, we had a young lady said her husband got the vaccine, and now he has blood clots that have moved from his leg to his chest. That wasn't there before. So for me, I'm not trying to upset anything and anyone and have a new problem on top of dealing with COVID. So if COVID is all I have to deal with, then I take my chances with COVID before I go ahead and give myself a shot.
Now, Dr. Pitts, before you respond, I want to thank everybody for being here for the Fathers conversation. I hope for those of you that are interested, you will join the Mothers to Mothers conversation tomorrow with Dr. Walls and Mrs. Graham, Davis, and Pender. And if you weren't here in the very beginning, I hope that you're going to be able to attend this Saturday. I think it's at Leak Center, 701 Yarnell. Is that Yarnell Street in Chester?
Yarnell.
They're going to have a vaccine and booster clinic. They're going to offer the Pfizer and the Moderna for ages 5 and up. If you wish to talk to anybody, the information is right there. Thank you so much for bringing up the advertisement. And also, of course, I want to give a shout out to cmpradio.net, because
Thank you.
without this, without them, without the space,
Right.
we would not have opportunities like this to just talk. Right. So here we go. Dr. Pitts, you've heard Mr. C's.
I
You know,
have,
So my whole thing is, what do we do? Like, talk how do you respond to this?
So first of all, let me say you do that commercial very well.
Yes, he does.
My friend. You are a natural at that. So
it's written on piece of paper.
Okay, there you go. So as Steve was saying, this is a numbers game, and I agree wholeheartedly. And for that reason, to address the issues that you raise and the concerns that you raise, these, as far as you wanting to see the numbers, there are article after article written about how the lifespan has decreased for everyone across these last 2.5 years, 3 years almost. And the information is actually out there. If you wanted to see numbers, you can do that. The other is that as far as African Americans are concerned, our lifespan is already shortened, and that's no secret to everybody. But I'll tell you, there's some concrete numbers, right? If you are in Philadelphia and you're in Center City, Philadelphia East, where most of individuals there are white, and for the lifespan, for the life expectancy for white people, for white men, is like 82 in North Philadelphia, 19140, Nicetown, Tioga area. The life expectancy is 63, right? And those are real numbers. There's a 20 point difference there. And that scares me, quite frankly. And the whole issue now comes along as far as COVID is concerned. And there are article after article written about the fact that blacks are 2 times as likely to die from COVID as whites. Now, a lot of that can absolutely be attributed to the fact that we've got a lot of things going on medically. We've got more high blood pressure. We've got more diabetes. We've got more asthma. Cancer affects us in disproportionate numbers. And these are facts. If you wanted to see numbers, we can show you the numbers. There's no problem with that. And so this leads me to the fact that because we have all these things that are going on medically, we need to get vaccinated and boosted, because Black people are dying for all sorts of reasons. And now comes COVID. We got to do something about it in order to decrease the rate. We're not going to raise the rate to beyond whites. We got a long way to go to do that. But we don't need to add on to the already exorbitant death rate of African Americans compared to other races. We just don't need to add on to that. Go ahead. I'm sorry.
If I can, Dr. Pitts. So
yeah, please.
If I'm hearing you, you're like, it's not just COVID, right? It's perhaps food insecurity, like food insecurity. Mm-hmm. And in addition to that, the fact that we might put a little bit more salt and a little bit more sugar in our yams. This is what I'm hearing.
And you hear me right. You hear me absolutely right.
How our babies live off of hugs instead of drinking water. But I'm not trying to preach.
No.
I'm
Go
just
ahead,
simply asking questions.
Preach,
but what you're saying is like the health expectancy, like COVID played a part of it. But if we wanted to have a holistic conversation, we have to look at so many other historical determinants. Right. And the thing is that, so, to be honest, you can't really have these conversations without understanding that but that perhaps our poor eating habits came from that when we were brought here, we could only eat what we were given.
That's right.
So we learned how to make things, beautiful things from scraps. Right. But all we could do was eat the scraps.
Right.
So we got to put that in there. So now look.
Right. Go ahead.
So we have a little bit of time left, right? Uncle P, you said you got kids. You got
Yes, I do.
You got baseball team.
Yes, I do.
Right.
Yes, I do.
And C's, you got a basketball team, right? Is that about right?
Mm-hmm.
And tell me about your kid. You said now C's, you said no. Uncle P, you said some of your kids are vaccinated, because they're older, but you still got some kids that are not vaccinated.
Absolutely.
Is that correct?
Yes.
So as a parent, are you leaving the decision to your kids to become vaccinated? Like, what is your position around vaccination and just your children?
My children, it's based off necessity. If they couldn't go to school without being vaccinated, they will have to get vaccinated.
Right.
You know what I mean? But that's not what the schools are doing.
Right.
You know what I mean? If you're suggesting that, so my daughter is a baby. I have a baby. I have a 1-year-old. And they said she had COVID. Oh, I kissed on that girl. I blew the snot out her nose with my mouth. You understand what I'm saying? Like, I take it, and I didn't have COVID.
Mm-hmm.
I didn't get COVID. So for me, it was like, if that doesn't give me COVID, if kissing my daughter when she's sick, wiping the snot off her, and licking my finger and cleaning her nose off, if that doesn't give me COVID, what will give me COVID? Like, what do I have to go through to get COVID? And then if that doesn't give me COVID, why do I need a COVID shot? When we think about why our children drink hugs instead of water, we look at Flint, Michigan. You know what I'm saying? Like, we look at the reasons why we do the things we do. We don't just do them. As much as people want to think we're just out here being against a shot, there are so many instances in history throughout life that makes you be like, that's why I do that. That's why I'd rather give my child a hug instead of water, because the water in Flint was knocking kids off, was killing people. So I can't say, it's distrust, absolutely. But it's also, let's wait for me personally, me by myself. Let's wait and see. You know what I mean? I told my daughter she was going to college, and they was like, she can't live on campus without her vaccination. She said, I just want to get out the house. Shoot, right here, hit me. And I was like, are you sure? She's 19 years old. I can't take that from her. She has to live life. I said, baby, understand what you're doing. Look at what you're doing. Look at which shot you feel as though helps you. She's like, I ain't fooling with the Johnson & Johnson because that's giving people blood clots. You feel me? Let me look at Moderna and Pfizer and see how that works. Understand how it works before you inject it into your body, or you allow someone else to jab you with it.
So, Uncle P, if I can now, you recognize and you do the radio thing, I do the facilitation thing. So we know that oftentimes we are not allowed to insert ourselves into the conversation.
Absolutely.
But I think that if I can just break with the facilitator code for the second.
Go ahead.
Something that we just forgot to mention, that the vaccination does not mean that you won't get it.
Right.
It just simply means that if you get it, that you'll be able to handle it. So, for example, I've been working in spaces like you with your kids. I've been working in a lot of spaces that there were a lot of people coming down with COVID. I caught COVID about 2 weeks ago, right? But here's the thing that we got to understand. Like, everybody that catches COVID isn't going to be like what we see on the 6:30, 7 o'clock news. Right. You have other people that are asymptomatic, people that are just, they walk around and then they can spread it, which is where a lot of our kids are. Right. So I'm going to ask this question, and then I have to step back into the facilitator role.
All right.
Right. So for me, a question would be like, if there were real information out there that were saying that the kids that aren't getting vaccinated are infecting the adults, to which that it's becoming fatal, right? As well as the kids that are catching COVID themselves, because there's a rise, at least in Philadelphia, of the young ones catching COVID, right? And we're not talking about Delta, we're talking about Omicron, and if you want to get fancy, we're talking about that BA2. But what I'm saying is like, if it's really trying to protect the village, if it's trying to protect grandmothers and grandfathers, aunts and uncles, what is the harm of getting the kids vaccinated?
There's a movie my children like to watch. It's The Lion. It's The Circle of Life, right? And I can't sit here and say, I'm not telling anybody not to get the vaccination. That's not what I'm doing. I'm saying this is for me personally. This island of me. You know, if it's my time, it's my time, man. Right? God wrote it. He put it here. He didn't. I can sit here and say, yeah, he didn't invent the vaccine, but he invented the person that invented the vaccine, right? He is the first inventor, the creator, right? And he put the knowledge that person has inside of their head, right? For someone's benefit. It's not going to be mine because I'm not fooling with it, right? I feel like, you know, I'll be good. But, you know, for my children, absolutely. I don't have a problem. And all of my children are not always in the same space at the same time.
Okay.
Right. So I have multiple mothers of my children. Right. So it's like, all right, if the mom gets COVID and she has COVID and she has a child and the child doesn't get COVID and she's always around the child, what's up with that? It's a disconnect for me somewhere. Right. If the child is testing negative for COVID, never positive, and she's been tested twice in the last 2 weeks and the mom has it, explain that to me. What is that going on? And mom's always with her. Mom's in there coughing and that doesn't make sense to me. So it's just like the way it's given, it switches up every now and then. How strong it is, how strong it attacks us, and like we said, we are most susceptible to everything. We accept. I mean, so many diseases in the Black community are higher in the Black community than they are in the white community. Why is that? Right? Why are we suffering from this? And I said it's miseducation. So for me, this is just me taking a step back from the whole situation and looking at it and judging it for what it's worth and saying, no, I'm not fooling with the vaccine. Now you can go get it if you feel as though it's going to help you do what you need to do, but I'm good over here.
So you're really, really sitting firm on the whole because of the fluidity of definition and explanation and consequence. That, you know what, you're like saying, like, if the conversation is so fluid, I'm not going to put anything permanent with me.
Right.
Like, that's what I'm hearing.
Right.
Dr. Pitts, what do you say?
You know, all I can say is I understand, but I can go further than that. And you know, and I hear you, Uncle P, when you say that you know, you're exposed, and you know you're sucking the snot out of your daughter's mouth or
yes.
nose.
Yes.
You
Blowing it out her mouth.
I hear you.
It's
You know
all on
what?
my face.
I appreciate the visualization. That's just
Right.
moving forward.
That's how my grandma used to do me.
I'm only using his words, right?
Right.
And I hear you. But you know, let me say this to you. The vaccinations, right? They are a pretty firm. I hate the word guarantee, but pretty effective sort of assurance or safety measure that you are not going to get severely ill, right? Not everyone at every time who is exposed to COVID will develop COVID. You know, not every, but if and when you do, without being vaccinated, you know, the way our immune systems work. And I understand, you know, you're using elderberry and
Yes.
and you know,
Yes.
Hey, I heard somebody. I've heard a lot of other things, right? So I hear that, but those aren't safe assurances that you won't get. You know, strengthen your immune system. Yes, perhaps.
Right.
But not assurances that you won't become severely ill if and when you contract COVID, right? And so what the vaccine does is it says, okay, I am going to have this assurance that if and when I actually contract it, I may have a few symptoms, I may have no symptoms, but I'm going to get up and I'm going to go on with my life rather than, you know, be sick for 5 days, 10 days, a month, 2 years because of the unpredictability of COVID. And that's all we're saying. You know, that's all we're saying. You know, it's like people say, well, want to wait and see. Okay, well, you know, waiting and seeing is like, okay, we know because we've waited that over 900,000 people in this country alone, have died due to COVID. You know, were some other things going on? Yes, perhaps some other things going on, but largely those people that died are people who are unvaccinated. Those are facts, and many of them, if not most, were African American.
Wow.
That's all I'm saying. That's all I'm saying. Anyway, you know, and I hear everybody's concerns, and I will say this to people that, you know, yes, do your own research. Please, I am making myself available to anybody who's got further questions to say, well, you know what? Maybe I might change my mind. Fine. I'll be here when you're ready to talk. That's all I'm saying, you know, because I'm not going to twist your arm. I'm not going to twist, you know, Mr. Z's arm. Is that right, Mr. Brown?
That's right. And Uncle P, it just sounds like whenever you're ready, Dr. Pitts is gonna make that trip down to Chester.
I'll be there, man.
So here's the thing. So we're looking at time. We got about 3 minutes left. C's, I got a question specifically for you.
C's is not on anymore.
I'm sorry, I'm not C's, Uncle P. I got a question specifically for you.
Okay.
What's up with street cred and getting vaccinated? Like what are the streets saying about getting vaccinated? Come on now.
I mean, the streets aren't fooling with the vaccination. I said this the other day. I asked a couple of my homies. I'm like, would you get vaccinated? He was like, no. I said, why not? He was like, you know, I don't know. I think when you're in the street and you spend a matter of time, and it's not. I'm not trying to devalue anyone, right? I'm not doing that. But when you're in the street, you're playing this game. You don't value your life. You know what I mean? It's like if I die, I die.
Right.
Like literally, right? So for me, it's let's figure this out. Let the strongest survive. The first people that were dying from COVID were the elderly people, right? It was mostly elderly people. Don't go around grandma. You give grandma. My grandfather's 95 years old. He has the vaccination. My uncle's right underneath of him, right? He told him, man, get the vaccination, get the vaccination. I said, Uncle, you know, I love you, but I never really listened to you anyway. So I'm not, and I love him. I love my family, but I'm not getting the vaccination because you feel as though I should. Because if I get a blood clot and it rises to my heart or my lungs or my brain, I have a stroke, you're going to say I died from COVID. You're not going to say I died because of the shot, because of the needle, because you don't want to scare nobody else from getting it. So for me, it's just, you know, I'll take my chances with COVID. I can fight it out. I can go in the hospital, do whatever I got to do. They're not putting me on no ventilator. I'm good. You feel me? I won't even go in the hospital. I'll sit in the bed. And if I go, I go. That's how I went.
So the whole thing is like, so I hear something that would be a beautiful conversation for a later date. That's sort of like that street life is just rolling the dice. Whatever happens, happens. Is that what I heard, Uncle P?
Absolutely.
All right. So as we start to close out, right? First and foremost, I want to make sure that we give another shout out to Dr. Motley from the Healthcare Solutions of Delaware Valley. I want to make sure that we give another shout out to cmpradio.net. Uncle P in the place, giving us this space so we can just have these beautiful conversations. But I want to leave. I want to ask two questions before we go. And before we get into that, I always got to remember to say, hey, tune in tomorrow, 7:00, Ladies for Ladies, Mothers to Mothers with Dr. Walls, Mrs. Graham, Mrs. Davis, Mrs. Pender. And there you go. Flip it. Let's go to the next one, because on Saturday you got the booster clinic where you can get your Moderna, your Pfizer for 5 and up at Leak Center. So we want to make sure that everybody gets that information. Uncle P, let me ask you this question, and let's literally try to keep this to like 30 seconds.
All right.
I want to thank you for being here. I want to thank you for creating this space.
Absolutely.
Have you learned anything today that would give you reason to reconsider other positions prior to sitting in this space?
I don't think I could learn anything that could have me reconsidering. One thing I do understand is that you don't know what you don't know, right? And sitting here with you guys, you know, has taught me a lot, right? And would I reconsider the shot? Absolutely not, right? I'm standing on that, right? And that's just where I stand.
but you will read the Washington Post article, and then maybe you and I can have a post conversation about that.
Oh, absolutely. I'm definitely gonna read it, and we can come back here and do another show. You know,
Oh, make it happen. This your space. All you got to do is
Dr. Motley. Listen, Dr.
We'll be
Motley
there.
is a friend of mine, and whenever she wants to use the space to come through and have these conversations, we can do it, bro. We can definitely.
So, Dr. Pitts, I'm gonna have you close this out. 30 seconds or less. 30 seconds or less. To those people that are sitting here with us now, and also are listening to us, that are still in the bubble about the vaccination, what would you say to them to give them some comfort, or to help them probably sit in a different space when thinking about the vaccine? Like, what would you say very briefly?
Well, first, I'd say I appreciate you being in this conversation, Uncle P and others, but also, do your own homework, but enter that conversation. Do not be afraid to get into that conversation and talk about some frank issues, right? And then secondly, I would say, we are about doing this for our community, right? And so it's not just me or any of those that are on this line, right? It's about how do we protect our entire community. We as Black people are certainly accustomed to thinking in that way, and we just have to continue to think about that way. And so the vaccination has to do mostly with protection of our entire community.
Absolutely.
And if I can, I always like to end where I started. I think I said for our ground rules, we got to make sure that we have a conversation, not a confrontation. I think we did that.
Yes.
I think we also said this is not about conversion, but this is about understanding. So I think as long as we got understanding, we have reached our goals. Gentlemen, on behalf of everybody assembled, on behalf of Dr. Motley, CMP Radio, on behalf of everybody, I thank everybody for participating. And I hope.
Can I ask a question real quick?
With one thing, that'd be good. What's up?
One question, right? We have a person that asks for the doctor. Once a person gets the vaccine, when are they supposed to get the booster shot?
To get the booster shot 5 months, at least 5 months after you've gotten your second shot.
So what's the purpose of the booster shot?
And that's with Moderna and Pfizer, with the J&J 2 months after. The purpose of the booster shot, very quickly, is that, over time, after you get that second shot of that initial series, over time, your immunity declines. It wanes, right? And it gets to the point where it no longer can protect you, right? And so you get a booster shot just to do that, to boost your immunity back up to where it's effective against the virus.
Absolutely. You coughing, Brandon? You all right?
I get tested twice a week.
Wow.
And it's only because of professionally where I am.
Absolutely.
Some people would consider me a direct line, right? So I do like 2 swabs and a PCR test every week. And the thing is, and I don't know how much extra time we have, but when I tested positive, because I have been taking the test so many times and they always came back negative. The only reason why I looked at that email differently was because I got the second email. I got that infamous second email saying that, you have tested positive. This is what you have to do and stuff like that. So I wound up reading that first. I was like, what am I getting this for? I was like, I never get this. And then when I went back and saw the results, I was like, here we go. This is where it's going to be. And Uncle P, all I can say is, I'm vaccinated, I'm boosted. My first 2 days really weren't that much. I had an appetite that I just couldn't stop. But then I got real tired.
Right.
And the way that it was explained to me, which actually makes sense, I was eating a lot because my body was fighting the virus.
Right.
But then what happens after a 12-round match?
Right. You're tired.
You got to take an ice bath.
Absolutely.
So my body was like, now you got to take an ice bath. Like I wanted to get up, I just couldn't. Right. So, and that's sort of where it is.
Well, I thank y'all for stopping through, man. I appreciate it.
Looking forward to another opportunity, man.
Absolutely. Real soon.
Yeah, we're really on board with doing this. And I'll tell you, my friend, Mr. Brown, he and I enjoy talking about this. So
Absolutely.
we'll be back.
Absolutely.
All
I
right.
appreciate
Thank you,
that.
everyone.
And I think the funny thing, Uncle P, is that you usually don't see a lot of us having very frank but fair conversations
Right.
about the vaccine.
Absolutely.
So I think that's what makes it unique. So thank you again for this opportunity. Shout out again to Dr. Motley. And I guess that's it.
Yeah. That's
Everybody
it.
take care.
Peace.
Thank you all. Peace.